comes to mind when I say public health?
Government-funded program that prevents the spread of diseases.
Public health also deals with immunizations.
Very good, Anna. Most of you have a general understanding of what public health is, but by the end of this lecture you will be able to identify the 5 levels of prevention. Before I explain the 5 levels of prevention, let me explain what the word prevention means. Prevention is defined as actions, measures, interventions, programs, policies, and/or legislations which seek to avert the development or progression of disease or possible harm. Everybody please stand up and give Carmelo Line a warm welcome. He is here today to explain to you guys everything you need to know about the 5 levels of prevention.
Thank you so much. You can have a seat now. My name is Carmelo and I work for the Public Health Agency of Canada as a public health officer. The Public Health Agency of Canada defines public health as the organized efforts of society to keep people healthy and prevent injury, illness and premature death. It also involves the combination of programs, services and policies that protect and promote the health of all Canadians. The first level of health prevention is primordial prevention, which consists of conditions, action, and measures that help decrease the hazards of health. An example of primordial prevention is the mandatory wearing of seat belts that was passed by legislation between 1975 and 2003. Vehicle fatalities decreased by 50% in Canada because of the mandatory use of seat belts. Seat belts were not standard equipment in the 1960s. It was through public awareness campaigns the first law was passed in Ontario in 1976. The second level of prevention is called primary prevention, and it consists of preventative approaches and interventions that seek to avert the occurrence of alterations to health. It also involves the prevention of diseases and injuries. An example would be the immunization of a child in order to avert the development of diseases. Immunization is a method of primary prevention that protects children from dangerous illnesses such as diphtheria, tetanus, whooping cough, polio and measles. The third level of prevention is secondary prevention, and it aims to reduce the impact of a disease through early detection, diagnosis, and treatment of a condition and disease. Screening sexually active teenagers for the presence of sexually transmitted infections is an example of secondary prevention. Tertiary prevention is the fourth level of health prevention, and it consists of activities that help prevent the further progress of an ongoing disease. Diabetes education program provides individuals with the skills they need to manage their glucose and insulin levels. The last level of health prevention is quaternary, and it involves the decrease or prevention of possible side effects caused by health interventions, treatments, medication, and/or programs. The action taken to prevent the individual from being over-medicalized is an example of quaternary prevention. It consists of health activities that protect the patient from medical invasion, avoiding unnecessary diagnostic procedures for bowel cancer in low-risk individuals,